All right, let's talk about one of the most vital skills in medicine, EKG interpretation. My goal here is simple. By the end of this, you're going to have a complete, systematic method you can apply to any EKG every single time to bring some serious clarity to the chaos. Let's dive in.
Okay, so I'm sure you've all seen memes like this one, right? The humpy bit, the lumpy bit, the jiggly bit. And yeah, it's funny, but let's be real. When you're looking at an EKG, a life is often on the line. Misinterpreting one of these isn't just an academic mistake. It can have critical, real-world consequences. So why bother with a rigid system? I mean, really, why? Well, it's because the biggest obstacle to getting an accurate read isn't always the squiggly lines themselves. Nope, it's our own mind. Just relying on pattern recognition alone can set a really dangerous trap, making us vulnerable to something called cognitive bias. And look, this isn't just some theory I'm throwing out there. This is backed up by serious research from the Medical Journal of Australia. This key study found that the story a patient gives you can powerfully and sometimes completely incorrectly sway your judgment before you've even had a chance to really analyze the tracing. And this is where it gets really eye-opening. Just look at these numbers. When clinicians got a helpful patient history, their accuracy was great, almost 9 out of 10. But give them a misleading history, accuracy drops off a cliff to just 4.2. This right here is why having an objective, repeatable system isn't just a nice idea. It's absolutely essential. Okay, so what's the fix? How do we fight this bias? It's all about having a reliable, step-by-step process that forces you to look at every single part of the EKG in the exact same order every single time. This is the method that makes sure nothing important gets missed.
So here they are, the core steps we're about to break down. We've got rate, rhythm, axis, intervals, then we'll look at the P's and Q's, and finally we'll check for ST and T wave changes. Ready? Let's start right at the top.
All right, first up, rate. How fast is the heart beating? Now, if you've got a regular rhythm, the box counting method is your friend. It's super fast. Find an R wave on a thick line and just count down from the next one. 300, 150, 100, 75. But what if it's irregular? No problem. Just count the R waves on a 10-second strip and multiply that number by 6. Okay, next up, we're figuring out the rhythm. Is it steady or is it all over the place? You can just eyeball this by checking if the distance between R waves is consistent. And then, here's the money question, to see if it's a normal sinus rhythm. Is there one P wave for every single QRS complex? If the answer is yes, you're probably looking at a sinus rhythm.
Step 3 is axis. And I know, this one sounds complicated, right? It's all about the heart's general electrical direction. But guess what? There's this awesome shortcut. It's a simple 2-thumb trick, and you only need to look at 2 specific leads. And boom, here it is. This visual makes it so simple. Just look at the QRS complex in lead I and lead AVF. If the QRS is pointing up in both of them, that's 2 thumbs up. You've got a normal axis. If lead I is up but AVF is down, you've got left axis deviation. See, it's that quick and it tells you so much. All right, let's keep building. Step 4 is intervals. Here we're measuring 3 key things: the PR, the QRS, and the QTC. Think of these as the timing for the electrical signal traveling through the heart. And if any of these are off, it can be a huge red flag for something serious like a heart block.
So take a look at this waveform. This shows you exactly what we're measuring. For the PR interval, we want it to be less than 1 big box, which is 0.20 seconds. The QRS complex should be nice and narrow, less than 0.12 seconds. And the QTC, which is just corrected for heart rate, should be under 0.44 seconds. Okay, step 5. Now we're going to zoom in on the P waves and the Q waves. An abnormally tall or wide P wave could be a clue that the atria are enlarged. And what about deep, wide Q waves? Well, those can be like a ghost, a little footprint of a previous heart attack. Okay, listen up, because this next one is absolutely one of the most critical steps. We're hunting for any changes in the ST segment or the T wave. ST segment elevation, that's the classic textbook sign of a heart attack happening right now. ST depression can signal ischemia, a lack of blood flow. I'm not exaggerating when I say this is where you save lives. All right, time for a little pro tip, a special case you're going to see all the time: bundle branch blocks. And honestly, the mnemonic William Morrow is going to be your best friend. For a left bundle branch block, look for a W shape in V1 and an M shape in V6. For a right bundle, it's just the opposite, an M in V1 and a W in V6. Super simple and crazy effective. All right, so we've got the system down.
we know the steps. Now let's put it to the test in a situation where every single second counts. During a cardiac arrest, a code blue. This is where fast, accurate rhythm identification is literally everything. When you're in a code, everything boils down to one critical question. Is this rhythm shockable or not? The ones you can shock are V-Fib and Pulseless V-Tach. The ones you can't are Asystole and Pulseless Electrical Activity, or PEA. Everything you do next, literally everything, depends on getting this right. And here we go. This is a perfect example of a shockable rhythm, ventricular tachycardia. Just look at it. Those wide, totally bizarre-looking QRS complexes and that super fast rate. If your patient doesn't have a pulse, this rhythm needs a shock immediately. And then you have this, asystole, the flat line. There's no organized electrical activity here to reset. You can shock this all day long and it will do absolutely nothing. The only thing to do here is start high-quality CPR right away to keep blood moving while you hunt for a cause you can fix. And you know, this really brings us full circle. In the absolute chaos of a code blue or just a crazy busy ER, it's so easy to get tunnel vision. That system we just learned, it's your greatest ally. It's what keeps you grounded, protects you from your own biases, and protects your patient from a misdiagnosis. Let's just look at those numbers one last time, because they're so powerful. Remember, getting a bad story cut a clinician's accuracy by more than half. This is the hard evidence. See, using a system isn't about being slow. It's about being right. It's about being reliably, objectively accurate every single time. So, if you take one thing away from all this, let it be this. Your job is to interpret the EKG, not the story. Let the electrical data speak for itself. Trust the system. So, here it is, your checklist, the tool you can take with you. Rate, rhythm, axis, intervals, P's and Q's, ST/T changes, and always, always keep an eye out for those special cases. Drill it into your practice. Every time, every EKG, no exceptions. Look, at the end of the day, this system is so much more than a checklist. It's a framework for thinking clearly when things are chaotic. It's a tool that can save a life. So the real question is, how are you going to use it?